Good afternoon. Today we will continue our conversation about errors in oncology that affect the life expectancy of cancer patients. Today we will touch upon such an important issue as errors in organ-preserving surgeries. At the end of the discussion, we will touch upon an important issue of when it is possible to operate on patients with metastases and widespread tumors. We will discuss the possibilities of cytoreductive surgeries, including incomplete cytoreduction when a residual tumor remains after surgery. The surgical method in oncology remains one of the most important in the treatment of cancer patients to this day. However, the development of new drugs qualitatively changed the place of this method of treatment. If in the middle of the 20th century, surgery was the only hope for recovery, today, thanks to the successes of the pharmacological industry, the importance of the surgical method has begun to decline. Moreover, with a number of malignant neoplasms, the surgical method has practically ceased to be used. And with many localizations of cancer, organ-preserving surgeries have begun to be used with good results. Organ-preserving operations for cancer require high precision and careful planning, since their goal is to preserve the function of the organ when removing the tumor. The essence of organ-preserving operations is that only the tumor is removed and the organ or part of the organ is preserved. For example, modern organ-preserving operations for rectal cancer. I will devote a separate broadcast to this topic. Recommendations for organ-preserving treatment of patients with rectal cancer. Today we are talking about organ-preserving treatment in oncology in general. Why has it become possible to preserve an organ for a cancer patient? Back in the 70s, I participated in the development and implementation of such operations in patients with lung cancer. Today, the issue of organ-preserving operations has been studied much more widely, and such operations have become routine in oncology for many cancer localizations. When performing organ-preserving operations, it is important to determine which part of the organ needs to be removed. Due to the complexity of such decisions, many doctors make unforgivable mistakes when performing organ-preserving operations, which reduce the effectiveness of such treatment and shorten the patient's life expectancy. What are the most common mistakes when performing organ-preserving operations? The first is insufficient oncological radicality, incomplete removal of the tumor, which can lead to a relapse. The second common mistake is an error in staging. An incorrect determination of the stage of the disease can affect the choice of treatment method. Third, today, organ-preserving operations are performed after chemotherapy, hormone therapy, and radiation therapy. Therefore, it is important to determine the degree of tumor destruction. Assess the change in tumor spread. Therefore, an error is inattention to the resection margins, leaving cancer cells in the resection area, especially when assessing the degree of damage to migrating tumor cells. A common error is incorrect definition of tumor boundaries, excessive removal of healthy tissue or leaving part of the tumor. Errors include damage to critically important structures, nerves, vessels, or other vital elements of the organ. A serious error is insufficient control of the lymph nodes. Missing the affected lymph nodes can lead to the spread of the disease. In order to avoid such an error, it is important to continuously monitor the condition of the lymphatic collectors during preoperative drug or radiation therapy. A common error is the wrong choice of surgical approach. This can lead to difficulties in performing the operation, residual tumor, recurrence of cancer, or complications. Many errors are associated with incomplete intraoperative control, lack of adequate control over the condition of the organ and tumor during the operation. Tumor cells migrate into healthy tissue, so it is important to remove as much of the tumor field as possible. Healthy tissue in which there are migrating cancer or stem cells. An error in performing organ-preserving surgery includes the use of inadequate technologies, the use of ineffective or outdated instruments and methods. There are errors associated with insufficient protection of healthy tissue. When healthy tissue is damaged due to careless handling of instruments, there are errors due to a violation of the suture technique. This can lead to suture failure or deterioration of organ function. Incorrect use of reconstructive methods, incorrect restoration of the organ after tumor removal, errors in determining tissue viability, an incorrect decision to preserve or remove part of the organ. Error, ignoring the patient's characteristics, such as age, concomitant diseases, which can affect the outcome of the operation. Incorrect assessment of anatomical features is possible. An incorrect understanding of anatomy can complicate the operation. For example, organ-preserving surgery for a small mammary gland. Organ-preserving operations cannot be performed in the absence of intraoperative diagnostics. For example, the use of ultrasound or CT to confirm complete resection of the tumor. Failure to observe asepsis and antisepsis increases the risk of infections and complications. A serious error is performing an organ-preserving operation with the wrong choice of the time of the operation. For example, performing an operation at a late stage when organ-preserving intervention is no longer effective. A multidisciplinary approach cannot be ignored. Lack of interaction with other specialists, which can worsen the outcome. The importance of a multidisciplinary approach in determining the order and scope of the operation in the complex of therapeutic effects on the tumor and the patient's body. A serious error is underestimating the need for rehabilitation, lack of a plan to restore organ function after surgery, and especially the restoration of the weakened anti-tumor defense of the human body after the end of special treatment. Each of these errors can lead to serious consequences for the patient's health, so it is important to carefully plan and perform such operations. Thus, successful organ-preserving operations require a comprehensive approach and attention at all stages of treatment. I have already said that today, when treating cancer patients, relying only on the surgical method is a mistake. Why is it impossible to operate on cancer, but it is necessary to comprehensively treat a cancer patient? In the 60s, it was discovered that even with small cancer sizes, cancer cells are already detected in the blood and bone marrow. This is how the concept of systemic damage in cancer patients arose. The consequence of this discovery was a change in the tactics of treating cancer patients. The importance of surgery has decreased, and drug methods have come to the fore. Such changes in tactics in oncology have changed the attitude of oncosurgeons to organ-preserving operations. If earlier oncologists tried to remove the entire organ with a tumor, today, with many neoplasms, it has become possible to perform organ-preserving operations. Their implementation has become possible due to the increased effectiveness of drug treatment. The emergence of new drugs expands the range of patients who can be recommended organ-preserving methods of tumor removal without reducing the effectiveness of treatment. Why is the idea that surgery can completely cure a cancer patient wrong? Numerous stem and circulating cancer cells remain in the human body, which are associated with failures after surgical treatment. At the same time, supplementing operations with drug and radiation methods that kill part of the cancer cells in the human body significantly improves the prognosis. Today's strategy for treating a cancer patient is to remove tumor cells from the body as much as possible. With the most common tumors such as breast cancer, lung cancer, prostate cancer, the patient's life expectancy is mainly associated not with surgery, but with the effectiveness of systemic exposure aimed at removing tumor cells from the human body. The surgical method is given an auxiliary role. With its help, only the remainder of the tumor is removed. That is why organ-preserving operations are increasingly common in the treatment of patients with malignant tumors. Despite significant advances in the treatment of cancer patients, it is not realistic to achieve complete removal of cancer cells from the human body today. Cancer cells are constantly mutating. Resistance of some cell clones to the action of drugs develops. Therefore, the use of only the surgical method can lead to long-term remissions in a small category of patients. These are the cases when relatives say that their loved ones lived for years after surgical treatment. Usually, these are people with a well-functioning immune system, in whom the cells of the immune system kill or suppress cancer cells. The mechanism of action of human lymphocytes on cancer is not uniform. Even at the same stage, histological and molecular form, there are no absolutely identical cases. Therefore, when planning treatment, it is important to determine the biological forms of tumors and the state of the body's anti-tumor defense. There is a small group of tumors for which the systemic nature of the lesion is not a decisive factor. Therefore, organ-preserving treatment in such patients can be carried out without systemic exposure. An example is ablation of a small kidney tumor when organ-preserving treatment becomes possible without additional systemic treatment. Patients often ask the question, is it possible to perform organ-preserving operations for large tumors? Is organ-preserving surgery a mistake in such cases? Here, it is important to determine the possibilities of drug and systemic treatment. And if we see a good tumor response to preoperative drug treatment, in a number of cases, organ-preserving operations can be performed for widespread tumors. But it is better not to take risks and perform extended surgical interventions in cases of widespread tumors. Advances in the creation of new drugs have changed the opinion of oncologists about the possibilities of surgical treatment of patients with advanced cancer. Moreover, such a term as incomplete cytoreduction has appeared. These are cases when it is not realistic to completely remove a tumor by surgery. For example, performing operations in the presence of distant metastases. But advances in the pharmaceutical industry have made it possible to perform such non-radical operations in some patients. In such cases, drug treatment, radiation therapy complements the capabilities of the surgical method. In patients with advanced forms of tumors, the prognosis does not depend on the operation, but on the sensitivity of the tumor to drug treatment and radiation therapy. And long-term good results are determined by the state of the body's defense reactions. That is why, in the case of advanced forms of cancer, after special treatment, metabolic rehabilitation is mandatory. Restoration of normal metabolism, which is associated with the anti-tumor activity of human lymphocytes. As I have already said, today the possibilities of the surgical method are significantly narrowing, and for many types of cancer, using one operation without additional therapy is a serious mistake. The successes of oncology in the treatment of advanced forms of cancer have led to the method of cytoreduction, the maximum possible but not complete removal of the tumor mass by surgical methods. Cytoreductive surgeries are surgical interventions aimed at maximum removal of tumor mass, often used in advanced stages of oncological diseases. In such operations, it is important to reduce the tumor volume so that subsequent treatment, such as chemotherapy, is more effective. However, as with any surgical interventions for cancer, there is a risk of errors, among which the most common are in patients with advanced forms of cancer. First of all, This is incomplete tumor resection, leaving a significant part of the tumor, which reduces the effectiveness of subsequent therapy. There may be errors in assessing the spread of the tumor. Underestimation of the true volume of the lesion can lead to inadequate surgical intervention. Incorrect assessment of the patient's condition. Performing an operation without taking into account the general condition of the patient. Concomitant diseases, which can increase the risk of postoperative complications. Error, injury to surrounding organs. Accidental damage to adjacent organs, for example, intestines, liver, which increases the risk of complications. Insufficient attention to the removal of metastases should not be allowed. Missing metastases, especially in distant organs or lymph nodes. Sometimes surgeons take an insufficient number of biopsy samples during surgery. Insufficient diagnosis of the extent of the lesion, which can affect the outcome of treatment. Due to large arrays of lesions, incomplete restoration of blood supply is observed. An error in the reconstruction of blood vessels, which can lead to tissue necrosis. A serious error is the wrong choice of the scope of the operation, performing too extensive or, conversely, not radical enough surgery. There are errors in performing lymphadenectomy. This is incomplete removal of the affected lymph nodes. Surgeons who do not know the basics of oncology often do not follow oncological principles, violation of the rules for working with a tumor, which can contribute to a relapse of the disease. This leads to an increase in the migration of tumor cells. With large volumes of tissue removed, there may be intraoperative bleeding, untimely or inadequate elimination of bleeding, which can lead to complications. Moreover, blood loss leads to hypoxia and stimulates metastasis. Failure to observe asepsis increases the risk of infectious complications in the postoperative period. An error is incorrect planning of access to the tumor. An unsuccessful choice of surgical access can complicate the operation or increase trauma. For example, performing laparoscopic or robotic surgery instead of open surgery. There are errors in the choice of resection method, incorrect choice of surgical technique for tumor removal. Violation of the suturing technique can lead to anastomotic failure or internal bleeding. Errors in surgical treatment of common tumors include incorrect use of intraoperative visualization methods, insufficient use of ultrasound, CT, or MRI methods to monitor the condition of the organ and tumor. A serious error is a violation of intraoperative diagnostics, for example, the absence of express histological analysis. Error in organ reconstruction. Incorrect restoration of anatomical structures can reduce organ function. The principles of a multidisciplinary approach cannot be ignored. Lack of interaction with oncologists, radiologists, and chemotherapists. Error. Incorrect treatment of complications. Untimely or insufficient response to complications such as thrombosis, perforation, infection. Especially the probability of thrombosis should be taken into account in patients who have had coronavirus or been vaccinated to prevent coronavirus infection. The risk of developing cancer in patients who have had coronavirus infection or are being vaccinated requires separate consideration. On this topic, I will prepare an interesting message in which I will talk about the prevention of thrombosis in such a part of patients. And I will answer the question, what is the connection between cancer and coronavirus? All these errors can negatively affect the outcome of treatment, lead to relapse, or increased complications. The success of cytoreductive surgeries depends on careful planning, strict adherence to surgical standards, and an integrated approach to treatment. However, in some cases, we observe when patients who have received only surgical treatment for widespread tumors live for years. What is the reason for this? Cancer cells continuously arise in the human body due to mutations. In a healthy person, the immune system is able to suppress the growth of cancer cells. In such cases, good treatment results are observed. Unfortunately, most patients develop cancer against the background of weakened immune defense. That is why in recent decades, oncologists around the world have increasingly focused on methods of strengthening the body's anti-tumor defense. I have already talked about the work in this direction. I will leave links to videos on this topic under today's broadcast. Sometimes doctors and patients ask, why do methods that strengthen the body's defense not only increase the life expectancy of a patient with cancer, but also cure the most common human diseases, such as chronic inflammatory diseases, hypertension, angina? The universal effect of general strengthening methods of treatment of the human body is associated with the commonality of pathological processes. Therefore, I began to post on my page a method of treating hypertension as part of a method of cancer prevention. Online treatment of hypertension is not complicated and highly effective. Anti-tumor regimens are orders of magnitude more complex. Therefore, I began the preventive work of my channel, not with the prevention of metastasis, but with the treatment of hypertension. The anti-tumor effect of shallow breathing after the end of special treatment, and the main regulator of metabolism, carbon dioxide, requires other modes of changing metabolism. Treatment of hypertension is much less complicated. The channel hosts the initial stage of normalizing the body's defenses in patients with hypertension. I plan to post anti-metastatic modes in case of your comments in the treatment of hypertension. Therefore, I recommend that patients who have begun to master my method of normalizing metabolism by shallow breathing post information about both the positive results of the method and the difficulties in the comments under the video of the procedures. In the next broadcast for patients suffering from hypertension, I will post the second procedure. You can find the link to the first procedure in the description under the video. Until the next meeting on my platform, where I post questions related to the prevention of the most common diseases of civilization. My conversations are important for that category of people who understand that nature, having created man, endowed him with unique self-regulation mechanisms. My task is to help those who want to master this direction and reduce the cost of purchasing medicines.